Hello. Over the last couple of sessions, we've been discussing cardiac conditions associated with ST segment elevation. We will continue in the same vein by discussing another interesting clinical presentation with ST segment elevation on the ECG. In today's case, we have a young man of 26 who comes to us with a history of fever and malaise for the last 1 week. So, we have a young gentleman, not your classical candidate for coronary artery disease, but he's been having a history of fever, and lo and behold, he comes to you with a history of chest pain for the last 3 hours. This chest pain, interestingly, is sharp, pricking in nature. Even though it is retrosternal, it does not classically radiate to the left arm. Instead, it radiates to the area of the trapezius muscle. And very classically, he tells you that this pain worsens on lying down and he would prefer to lean forward because that gives him relief. Being a creature of habit, you would prefer to go ahead and do an investigation, and this is the ECG. Observe the ECG closely. Look at all the leads, the anterior leads, that is V1, V2, V3, V4, closely. See what changes are there. Look at V5, V6, 1 and AVL. Okay, you can see there are some changes there as well. The changes in 1 and AVL will be very much milder as compared to V5, V6 because those are, as you know, limb leads. Finally, you can also look at the inferior leads. Okay, you know what the inferior leads are: 2, 3, and AVF. So you can see there are some changes in the inferior leads as well. Okay, pretty much it should remind you of our last case of myocarditis because here too you see diffuse changes. Yes, there is quite a possibility that our gentleman is having myocarditis. And if you do a study of the troponins, you will find that the cardiac enzymes are also mildly elevated in this individual. So you can see there are some ECG changes. You can see there are some troponin changes. And just to add a little more in this case, I would say have a look at the X-ray in this gentleman. Even the X-ray seems to have something interesting about it. Now, look at the choices that are given below and pick one of them, and we shall carry on after you have taken that test.